strangest feeling to know what to believe in.
Hi, my name is Vinita Chandramodi, and I'm the founder of Stroma Physical Therapy and Ischemic Conditioning Techniques, or ICT. I started this practice to have creative flexibility to give my patients the best possible care without constraints. No cookie cutter therapy, personalized, targeted, and effective therapy to get people stronger and better. We don't just teach you what to do, we teach you how to understand your body as you are the captain of your own ship. It's not just about performing an exercise or lifting a leg, but activating the right sequence of muscle patterns to create the optimal effect. At Stroma, we look at how pain and dysfunction influence the whole body, not just the area that hurts. After all, we are a fine-tuned machine. As a manual therapist, I realized that we could influence and treat much more than just a single muscle tissue. So I developed a full body technique that uses mild blood flow restriction to help influence tissue repair. All of our therapists here are trained in the technique. The missing ingredient in most PT is love. We love and are passionate about what we do here at Stroma so that you can become your best self. Come to Stroma so you can move, perform, play, walk, stand, live, heal, and finally feel better.
Screening and triage. So in this slide, I wanted to highlight how to deal with a patient coming through your door. So for all PTs, what I recommend is asking good questions is going to be your most important tool for determining whether or not a patient might need more care, whether it be pelvic floor care, or just regular care. Asking good detailed questions is such a key component for understanding your patient. Birthing, what I find is that you can talk about low back pain and hip pain, but practitioners won't ask about birthing history. Well, birthing history is relevant to the hip and the low back. If somebody had a massive episiotomy or had their levator ani pulled off the ischium, I think that's a relevant piece of information for your patient that comes in with a hip labral tear. So asking about birthing history, surgical history, if you're comfortable asking about poop and pee, I find that if there's a patient that comes in for low back pain, not pelvic pain, but low back pain, it's hard to broach maybe sexual function, but what I think is really key is using good outcome measures that might help you address those questions more accurately if something turns up in an outcome measure. So if you're handing them an outcome measure, like such as the Westbury low back scale, had a component that we have one in our clinic that we utilize that has a sexual function component. So we can ask the question without asking the question. So reading the outcome measures. So asking good questions about both gastric and urinary environment. For low back screening too, that's really important to ask anyways. But utilizing your outcome measures, there's a list on the APTA Pelvic Health website that really does a really great job at showing, giving you different options for outcome measures for gastric, urinary, sexual, chronic pelvic pain. It has a whole, it's kind of categorized all of these different outcome measures. So I definitely peruse that. And if you're suspecting your patient might come in with certain issues, then it might be worth even handing that to them, printing it out, or suggesting them look at it and maybe coming back to you on the next session with answers that might help you direct your patients better. And this is for all PTs. I put in this little central category here using the PVAS, which I will discuss in the next slide. The Pelvic Visual Analog Scale is a scale that I developed, and I'll talk a little bit about it on the next slide. Now, for the non-pelvic PTs, you're asking good questions, you're using your outcome measures that might help you address whether or not there's some dysfunction happening in those areas. but looking at, so once, what do you do with that information, right? So the answer is you can either triage to an MD, you can triage to psych. Sometimes these issues might be might have something to do with anxiety or depression, or triaging to pelvic floor PTs to do the triaging for you might not be a bad idea. For pelvic PTs, now, if you decide that you want to become a pelvic PT, but you might be seeing a variety of patients. You might not just be seeing only pelvic PT. We don't only see pelvic patients in our clinic. You want to know when to present pelvic PT to a non-pelvic patient. So if somebody comes in with, like I said, right hip pain, when is it a good idea to think about whether or not pelvic PT will be a good approach? So often I'm presenting prognostic features of a labral tear. I'll say, if I'm not getting you better in X amount of sessions, maybe we should look at other things. So priming them for other potential mechanisms for their condition is a really nice way to handle it. Now, obviously, when you are a pelvic PT and are seeing a pelvic patient, the answer is obvious. Like, you just perform your, they're coming in, they know what to expect. You describe what you're planning to do as a pelvic PT, and then you go ahead. But it's in those situations where you're not sure if that's what's going to work. How do you present to them that would be an option? And that takes skill, and that takes the right language. But you as a pelvic floor PT might also be triaging your patients elsewhere. Maybe you need more medical help. You need a GI support or a urogyne support, psych support. And I talk about psych here because I think as a pelvic floor PT, it's impossible to be everything to one patient. You want to be there for your patient, but you're also not their psych. You're not their psych. And so and I think the best care is when you start to divide and conquer and work in a multifaceted approach with your patients. And so pulling in psych when necessary, knowing that it might not be in your scope of practice to be able to be psych, but learning the language around how to deal with your patients and broaching the subject and working collaboratively, I think is the key to success with getting these patients better. So I'll talk to you a little bit about the pelvic visual analog scale. So I developed this scale in 2017. And the reason I developed it is because I had both patients coming in, having seen fitness professionals, not understanding what was happening in their pelvic floor environment. And so I wanted to put together something to be able to give patients information and power about their own pelvic floor environment without having to get assessed. Even when a patient would go to a gynecologist, they had no idea if they were hypertonic, hypotonic. They may have some symptoms. They weren't telling their gynecologist about it because what they thought was common was normal. And that's not always the case. What is common isn't always what's normal. So these patients, I put this scale together to discuss tonicity, vertical displacement of the pelvic floor specifically. I did a whole write-up on this. It's on our website, www.stromapt.com. And if you go under the blog section, you'll find it there. But it's basically similar to a visual analog scale for pain, but it's one for the pelvic floor. It can be used by the public, but it can also be used by non-pelvic practitioners and fitness professionals to help with either prescriptive exercise decisions based on new information that they were acquiring from the patient themselves. Because often it's the patient's experience that will help you decide whether or not you want to train up in a hypotonic environment or train down in a hypertonic environment. So if we had more information as a non-pelvic practitioner or as a fitness professional, maybe we could serve our patients better. And so I am looking at applying for a grant right now on with the IPTA's pelvic health area. And my clinic director is going to speak a little bit more about it during our question and answer period. But basically I use this as a triaging tool as well, because sometimes I have a neck patient that describes that she'd been jumping rope and leaking. Well, I say, okay, well, look at the scale and let me know what your numbers are. And when they tell me their numbers, I can decide whether or not I can give them a few tricks already without having to assess them on what to do to help them get through their issue. And if it needs more work, then as a pelvic floor PT, I can do it and I can treat them. Or if I wasn't a pelvic floor PT, then at least I know that I might need to triage to a pelvic floor PT or an MD because these symptoms are coming up. You learn a lot about your patients in PT. So much of our work can be idle. So you want to take that information and be able to give your patients the best possible outcomes as possible and give them information. So I am going to close. Oh, I'm doing pretty good on time. I thought 40 minutes and I'm almost there. So I want to close by saying you can be anybody you want to be with commitment, focus, and perseverance. So I have always loved this profession from the day I graduated. I didn't realize how much I would love this profession. And the reason I do is because PTs can touch all fields in medicine as one single practitioner. So I'm a strong generalist. There's a lot of hats I wear in my clinic, and pelvic floor is one of them. I love that you can be an orthopedist, a neurologist, a pediatrician, a dermatologist, a gynecologist, a GI, you name it. You can sort of be all of these things to your patients. And that's sort of what I love most about being a generalist. So I happen to be very, very passionate about pelvic floor therapy, but weirdly, I'm also very passionate about blood flow restriction. And so I wear these different hats. And so if anything you can walk away with is knowing that you can sort of be whatever you want to be, as long as you work hard and you focus. Your coursework that you decide to take in the future, I suggest you pace out because it will really influence how you form. And I think you can, like I said, be what you want to be as long as you're willing to put in work and learn. So let me see what I have next. I think that's pretty much it. So if you need to contact me, there's my email address, Mairead's email address as well, and info in case you want to contact us. And I just want to highlight that's the Herman and Wallace and APTA Pelvic Health if you are looking for more information about coursework. And now I'll take any questions you have.